Good evening, everyone. A very warm welcome to Liver Cancer Month Awareness, a nationwide public health campaign organized by Voice of Healthcare in collaboration with Izai Pharmaceuticals. I am Dr. Muskan Ahlawat representing Voice of Healthcare, and I will be leading today's insightful discussion. It is wonderful to see so many of you joining in, showing your interest in understanding and protecting one of the body's most vital organs, the liver. So, liver cancer is often referred as a silent killer. Why? Because it tends to develop quietly without major symptoms in its early stages, therefore, making awareness and early detection is even more crucial. Our liver performs severe essential functions from detoxifying harmful substances, aiding digestion, and storing energy to maintain the metabolic balance. When it is not functioning well, the effects can ripple across every system in the body. In today's world, our routines, the processed diets, alcohol consumption, and stress can affect our liver so much that the pressure on the organ can be unbearable. That's why conversations like this, focused on awareness, prevention, and early action, are so important. Today, we are privileged to be joined by Dr. Satheesh, consultant medical oncologist at HCG Bangalore. Dr. Satheesh brings with him deep expertise in cancer care and patient centered oncology practice. He will help us understand the early signs, risk factors of liver cancer, the impact of lifestyle, and the latest advancements in treatment and screening. So, without further ado, let's welcome Dr. Satheesh to begin our today discussion.
Thank you for a kind introduction. Yeah, definitely. We are seeing a lot of cancer day to day now. With the awareness program on multiple cancer, today we are going to talk on the what is the awareness towards the liver cancer. Definitely, a lot of things we have to learn actually, and we are learning from each patient is a complex cases. Definitely, we have to get awareness what is important about the liver cancer because liver cancer, like it didn't, not going to show any early signs like the other breast cancer. Commonly, we'll see lump before the bigger major symptom starts. Here is a like a symptom doesn't start early until it's very advanced stage. We'll call as a silent killer in our
Yeah.
cancer among the body. That's what early signs. Sometimes we'll see that you can get a fatigue, unexplained weight loss, and that loss of appetite is there. Abdominal discomfort, bloating sensation can be there. Sometimes you can have a yellowish urine or eyes. You can get it. Definitely, you should don't neglect. Many of the patient like they'll try to just to take some visiting some local registered practitioners or doctors. They'll go with only gastritis medicines. Should not be ignored. Should get at least like because once you have the aged person, actually you can have a, it can be problem with either in the vital organs in the liver, kidney, or bladder. Like definitely at least some simple screening, like a simple blood test, all the thing definitely helps actually, because just going with a continuous just gastritis medicine not answer, because this the opportunity will come. If you miss that early signs, if you pick up, we can definitely give the good treatment. You can have a longevity of life, and can chance of even a cure in early stage would be there.
Thank you. Thank you so much, Dr. Satish, for explaining about liver cancer and how early detection is so important. Sir, to start with, first we would like to know that why liver cancer is commonly referred to a silent killer, and what quiet signs one should watch out before it's too late.
Yes, I think we had a previous conversation. It's not like easily we'll diagnose. Like it is an internal organ compared to the external organ, we can get easily some symptoms. Is most liver cancer often shows no symptoms until is very advanced stage. In early stage, I said about fatigue. Easily, you're getting fatigue, like tiredness, loss of appetite, weight loss, and abdominal discomforts are there. Please visit your doctor, and yeah, they might give prescription. You can continue that medication, but doesn't improve by like a couple of weeks. please don't get ignore it. Like, doctor, I'm not getting better, please can you do get some scan or something, a blood test. Definitely, like, should not ignore it. And like, because many times, like, if we'll be keep visiting changing doctors, that should not do it actually. Routine checkups and imaging, and definitely you can pick up. And those with a high risk, because like already you're a alcoholic, you have a obesity, diabetic is there, like these are people high risk of getting now, like, not only virus induced liver problem, there are two, like three major problems, like virus induced liver, chronic liver damage, then is alcoholic induced liver damage, and now this like NASH, non-alcoholic hepatic disease, will tell NASH induced. That is one of the most common cause. Like, you know, is non-drinker, no any viral hepatitis, but you can coming with a chronic liver disease because of the alcohol, like non-alcohol induced fatty disease. Like, it will tell that, like, those are obese and diabetic, and those are having a lot of stress. They like to have this kind of problem. These persons, like, they definitely, I'm at a high risk. Can I get a
Hmm.
checkup screening? I can get a simple blood test, liver function test, ultrasound imaging of the our abdomen. It'll tell us, okay, something wrong with fatty liver. Previously, we used to ignore. Being a doctors, we tell, okay, just you try to have a exercise, control your diet. Now the medications also come in a Western country. In India, we don't have that, but definitely you should not get a fatty liver. Fatty liver is also not a good thing. If fatty liver is there, you should watch out. You should have a continue to have a screening modality, like 3 to 6 month imaging and blood test, your tumor marker will tell. And you should watch out for your symptom abnormality, anything change in your appetite, weight loss. Don't wait, please visit a doctor, or like gastroenterologist, or like a oncologist. Something wrong with my body, I should get investigated. Yeah.
Thank you so much, Dr. Satesh, for explaining, basis of liver cancer. Sir, as you were mentioning about diet and, fatigue or exercising. So my next question is related to that. That, sometimes we overeat, like alcohol consumption, and, abnormal sleep patterns are nowadays very common. So, do they also affect liver health? And, coming festive season, how one can celebrate joyfully without compromising their liver?
Yeah, it's a very important. The question is, like, here, like, the nowadays the people, they're like war things. They'll do war thing if they're allowed to have a parties, or like you want a festival thing, or so many things they like to have a, like a alcohol consumption party, or eating also. Because of sleep disturbance, or sometimes you have a relaxed period of war sleeping also. Yeah, everything will do war things. That's what, like, until you, like, then you may have change of habit. But this overeating definitely, like, and also alcohol and the sleep disturbance, definitely they decrease, like, alter our metabolism of our body, and disturbance of the fat deposition, that is known as stress, is going to cause to our liver. Fat deposition will happen to our liver. That definitely is causes the problem in that balance in our body, the physiological mechanism for fat, carbohydrate, and protein metabolism and balance actually. That's why I recommend actually to go for a, whatever you do, that you do it, enjoy your food, but don't go for a very overeating, binge eating. And you have to moderate, and you should the mindful eating should be there. That's what. And avoid a binge of drinking also. Yeah, you have that company that alcohol is not, I'm not recommended to drink alcohol. I'm telling you, please, you do in a control way, and try to even avoiding and stopping alcohol as I recommend actually. And other, not only alcohol, now coming to non-alcohol also, you do like exercise, and in the balanced diet also. And you enjoy the different variety of food you want to eat it, like you in a control manner. Don't like that you have to be like completely I'm satisfied, like that. You have to control your diet, and even sleep also should have adequate hours of sleep. Sometimes you don't sleep at all, you'll be voracious of your work, office work, stressful. Sometimes you'll be sleeping, like most of the time weekend, all the thing 2 3 days you'll be sleeping. This is the sleep, and your alteration definitely alters your body metabolism of your diet, protein, like that, like a fat metabolism. And they definitely try to cause stress induced. The liver damage can, by the inflammation causes the liver, fatty infiltration will happen. That is a long standing is not a good thing. That's what I wanted to go for a change your habit.
I agree with you, sir, that moderation and mindful choices, can make our body and our lifestyle way better. So, sir, as you were mentioning about alcohol, and most of people think that only alcohol causes liver damage. So, are there any other lifestyle habits that can harm our liver over the time?
See, I think beginning when the introduction time I told the chronic damage to the liver can
Hmm.
be various causes. The one of the common cause was the liver, like the sorry, that alcohol-induced liver damage
Alcohol.
will tell.
Hmm.
And next is a viral hepatitis. We'll say hepatitis B and hepatitis C virus can be there. A chronic inflammation in the virus-induced liver damage. Next is the that now what we are saying the that what our lifestyle is coming in a picture, sedentary lifestyle and obesity that are containing a high carbohydrate, a high sugar containing diet, stress, and you don't have the physical activity. The stress is definitely elevates the or fatty liver disease. The definitely chronic stress releases the that cortisol that definitely causes the fatty depression in the liver. The chronic inflammation steroid in like it's going to cause inflammatory reaction in the liver, going to cause the imbalance in our liver metabolism. Liver health is going to get altered. That's why alcohol is not the only cause. I told listed various causes. Regular exercise, balanced diet, stress management. You have to learn actually how you learn actually like every employee, new employee when you come to join any organization, they'll try to know how to our organization how they'll train actually. Your body also get tuned to for that. How your diet mechanism, actually diet, or how you have to eat, and how your physical activities, sleep, stress, how to reduce that. The stress management is very very important. You'll be definitely your imbalance with the work and personal life. Definitely you have to give a good like a time, like you cannot be all the time working and you cannot give the relaxation like you cannot omit actually. Personal life is also balanced, the relaxed life also is more important. But to stress management is very key important here to reduce this that non-alcoholic liver damage, chronic liver damage can be avoided.
Thank you
Okay.
so much, Dr. Satesh, for explaining, the risk factors and causes that may develop into liver disease or liver cancer. So, sir, moving onwards, I would like to ask how important is regular liver screening, and what are some affordable or available diagnostic tests that individuals should be aware of for liver disease or liver cancer?
Yeah, see, many cancer we have a screening program, breast cancer like
Hmm.
that, like liver also we can have a screening program. The already that we had done some visited a hospital, we found to have a chronic liver damage, like a chronic liver disease is there. Those people definitely they are a high risk category. It can be alcohol or non-alcohol induced damage. It can be now
Hmm.
non without liver damage, a fatty liver like chronic fatty liver like an inflammatory disease like will tell and like those kind of they're like those are with diabetes and obesity, they are high prone for this kind of non-alcoholic fatty liver disease very common. Those if you find out, okay, I have done now many people, many of us were getting health screening program because of
Hmm.
master health check programs are available now. Or like where they say like children like those are working in IT company, or many like screening programs are there. Breast, how you have a mammography, pap smear for the cervical cancer, like the various cancer, the liver cancer. I'll tell you simple test is about the those are a high risk category. Those should get a simple blood test, liver function test, blood test. Can have a liver or function, any bilirubin abnormality, anything enzymes abnormality, anything is there, and also like those are already chronic liver diseases there because of various causes. Can be alcohol or non-alcohol. There's a alpha fetoprotein is one of the tumor marker will be done, and hepatitis virus because you have a chronic liver disease. You should find out what is the reason because I'm not a alcoholic. Why that my liver is got damaged actually. In the future will be had I have will I had risk of getting a liver cancer. That's why I should get it. If any hepatitis is there, hepatitis B under control or not, hepatitis C is there, hepatitis C infection is there, I can active inflammation can get cured with a antiviral medicines are available. The drugs against one hepatitis B virus also there. We can keep that virus under control. Ongoing liver damage can be avoided. That's what these are the screening program we have to do. And simple ultrasound, what I said is earlier, ultrasound of abdomen is going to tell us, okay, your liver is like at a normal status of health, or like already liver damage has started or not. Once your liver damage has started, definitely you have to monitor that. You cannot ignore it. then ongoing liver further damage can be worsening can be avoided by the that lifestyle modification. Ongoing, if suppose viral etiology, I have to control with a virus activation, damage of liver damage can be avoided. These are things are like very affordable cost. I can do that. The watch over to your symptoms, your person is it like a liver function test, tumor marker, ultrasound test, and along with the virus screening is more important actually. The bigger, like already you have a suspicious problem, then we'll go for advanced technology of the imaging known as the CT scan, MRI, sometimes PET scan. These are things that once you prove that liver cancer is there.
Wonderful insights, Dr. Satesh. So we have been talking about basis of liver cancer, coming to diagnosis. So can you highlight some new therapies or treatment that are available now for liver cancer, and how are they aligning for better outcomes for patient?
See, liver cancer treatment depends on the stage and a patient performance status, and there is a stage like the patient fitness the treatment. Childhood staging will tell there's a Barcelona staging system is there. Based on the staging system, we'll see that patient is will the patient is eligible for curative treatment, transplant eligible or not, surgery feasible or not, based on the stage wise. If the patient is coming in intermediate stage, can I do local regional treatment in the form of TACE or like a TARE treatment will tell. Selected directly give the medication or internal radiation, all those things due to the selected liver tumor. Next is advanced cancer. Already, the most of what we see is around 60 to 80% of patients are in already advanced liver cancer because early stage we are not able to pick up actually. Even though many chronic liver disease, they don't do the regular screening and follow up, they don't do. Ultimately, finally land up in suddenly advanced stage of liver cancer. These cases now advanced the medical management is available now with the target therapy because many cancer will treat with the chemotherapy. Chemotherapy doesn't hold good in a liver cancer. We have a like the advanced novel medicine with the target therapy in the form of tablet forms are available. Linmatinib will tell that is made a lot of change in our management of our liver cancer, and the newer drugs with the immunotherapy. Immune checkpoint inhibitor drugs are available by combined drug with the immune checkpoint inhibitor with the TKS or with the immunotherapy drug and the targeted drug bevacizumab. These kind of newer drugs definitely made our liver cancer management very easy. Definitely make the patient disease good control of the liver cancer, improving good quality of life, and also like definitely try to have the longer life in compared to the what we used to see older 4 5 years back. Definitely we don't have much option. And now that with the integrating with the multimodal treatment like surgery is in the early stage, and like even the advanced stage is where advanced technique of radiation, SBRT, and immunotherapy is there. Definitely try to focus on the quality of treatment in the liver cancer. Definitely try to have the highest possibility of disease control, longer life with a good quality of life.
Thank you, sir, for highlighting the new treatment approaches that are available in India, and I think they would definitely help someone to improve their quality of life. So, sir, lastly, can you give some highlights on how can families or the communities create a more supportive environment for individuals who are recovering or undergoing some treatment for liver cancer?
See, in India, with many cancer patients, they're treated as a social stigma. See
Hmm.
that either you whether working in office or friends, family, like you should not see that it's not a communicable disease. It is not going to spread actually. Should have a good empathy, encouragement, emotional support is important, and a lot of social support and like counseling because even the closed one actually see like even anyone can get a cancer like a even chronic disease like diabetes, hypertension, cardiac problem like that's many people are at risk actually. Should
Hmm.
like support empathy and social support counseling is very very important actually. And these definitely makes that the patient those who are suffering with the liver cancer makes that their immune system and try to align with the ongoing cancer treatment. Definitely they'll bounce back and try to uh, good control of the cancer will be there. Definitely gives that a positive confidence in the patient. Many patient because of this one depression, and they don't have lack of support with the peer groups, so family support. Definitely land up with some people. Many of the patient they don't land up with taking the cancer treatment. Sometimes the elderly people, the children are not supporting, family member only not supporting. These are major issues what we are finding in India. Definitely it can be changed. You can give a good quality of life, good social support, whatever you have that the months to years that you can have a good quality of life, and that is more important for those who are suffering from the liver cancer.
Thank you, Dr. Satesh, for highlighting the importance of psychosocial and psychology nowadays. That people often overlook these. So, sir, before we close, let's take a quick look at some few common myths that are generally seen about liver health. So, my first myth fact segment question would be that, sir, there is a common notion, once liver is damaged nothing can be done. So is that true, or liver can heal when proper care or early medical attention is given?
No, liver status is important. The stages like is a chronic liver disease or normal stage. If any like a liver can able to the try to avoid it is a tendency to have rebouncing with a regeneration of a liver nodule. That many people they're like chronic damage from the alcohol or like virus induced damage and many other causes is to try to withstand and people make the people to live longer. Normal person definitely even up to 40% of liver is enough to live. Actually many people they'll try to donate the organ also. People can live by donating part of the liver also. Our normal liver is having capacity to regenerate the capacity to live without any problem. But definitely that anything problem like it should not be too much, like it should not be damaged actually early. If any damage dangerous part to the our liver, either infection, inflammation, drug induced problem, or toxins environmental, or the alcohol or smoking related anything is there. If you like ongoing damage, you can stop it and you can definitely you can reverse back. Liver enzyme is bounced to back and to the normal function actually. That's what the and if already irreversible damage, a chronic fibrotic stage and is there, then that is the risky stage actually. Early definitely we can overcome the this damage. Ongoing damage can be prevented if liver enzyme is bounced to normal functions.
Thank you, sir, for clarifying this myth. Next question or myth segment I would like to ask is that some people, think that after a day of heavy drinking, they can drink plenty of water and get some good sleep to quickly flush out the toxin. How true is that? Is daily habits can help us recover faster?
See, like, is a good question. Actually, many my close older friends and so close family members also they asked actually, can I drink? I can
Mhm.
overcome, compensate by adequate hydration, all the thing.
Yeah.
No, like, see your hydration, good health, sleep, and balanced diet is very good for your health of any individual actually, but that they cannot like replace toxic damage what is caused by the alcohol or any other water our habits is going to cause a chronic damage to the liver. I cannot compensate by just giving hydration. You can, yeah, definitely you can flush out your the what are the daily needs, whatever you are taking the body abnormal substance, you can hydrate and flush out through the urine or stool, all those things is fine. But I cannot replace I cannot overcome by alcohol damage. Can I replace by hydration? No, that is a very wrong thing actually. Please like that try to help you or normalize your healthy, like you have to be fit, you have to be that you have to have a balanced diet, and good hydration is very important to have your circulation to all the organs, and also try to have to reduce your stress factor and adequate sleep. They are all overall try to keep your body mechanism in a balanced way, immune system in a good like physiological condition. Those are important for our day-to-day normal life. But that whatever like ongoing like an I'll be taking blink and I'll replace by like this, because like you're when you're praying God, like I'll do wrong thing, I'll go for a praying like every day, like God, actually I'll pray this, please excuse me, like that. You should not do that actually. Please, like that, whatever the ongoing that it is damage has happened, like please, like that you are to ongoing further new damage should not happen by ongoing than chronic ingestion of toxins, either excess of binge of eating and sedentary lifestyle, stress factor, any things going to cause the chronic damage to liver and even alcohol also. Definitely, you please stop it. Can please try to maintain the health. Liver health is very very important actually. That is anything is there like that has to metabolize through the liver. Any substances ingestion to the body, definitely it has to go through the liver. That is liver is a very very important organ.
Thank you. Thank you so much, sir, for clarifying these myths. I think it's very important for everyone to know that there is no quick fix for liver health. Timely action and healthy habits are the things that one must follow. So, sir, as we conclude today's session, I would like to thank you for your valuable time, your deep insights, and your practical advice, sir. Thank you so much.
Thank you, doctor. Thanks everyone.
Thank you, sir.